hello and welcome to all our viewers from around the world. I'm Kristen Schwartz, licensed midwife and one of the MCs here at Gold Learning. And today I have a special guest with me, and I'm chatting today with Dr. Gayatri Jape about her upcoming presentation with us here at Gold at the Gold Neonatal Online Conference. Welcome, Gayatri.
Thank you, Christine.
It's wonderful to have you here, and I want to talk a bit about your topic in just a minute because it's a fascinating topic. But first of all, since this is an international conference and we have an audience and presenters from all around the world, where in the world are you located?
I'm located in Perth in Western Australia.
That's absolutely beautiful. And I know we had chatted a little offline before how we can be in different time zones and be together and learn learn here at Gold. It's fascinating. I'm coming to you from South Florida. Our colleague who's also here behind the scenes is from Gold from Canada. So it's just such an international event. I really enjoy it. So that makes it very special. So tell us a little bit about your professional background, a little bit about your professional journey, so we know a little bit more about the work you're doing.
Yes. So thanks, Christine, again for the warm welcome. I am a neonatal pediatrician currently working in the Seoul Tertiary Referral Hospital in Western Australia, and we cater to at least 6,000 deliveries every year. Yep. At least 2,000 of these are born below the age of 34 weeks. And we have at least 110 or 120 infants born every year who are born at less than 28 weeks. So which is sort of the really high risk premature group that we know. And we are referred from different places in Western Australia. So for those of you who are not aware, Western Australia has a very typical geographic diversity and a very large population base located in different pockets, actually, which is very difficult to access. So, most of the times as members of the retrieval team, we do go out to get sick babies from, we have to fly nearly like for 4 hours or so one way to get babies a few thousand kilometers.
Wow. Yeah.
So, yeah.
Oh, very interesting. Well, thank you for sharing that. Yeah. And let me ask you this. It sounded like a very high rate of preterm infants. Is it because you are the referring hospital where others refer to, or why is the rate so high?
Because we are the sole referral hospital, so most complicated pregnancies from all across the state are actually referred to our hospital for management, as well as, if unfortunately they end up in preterm birth, then to try and optimize the outcomes of these infants.
Yeah, wonderful. As one of your specialties is actually the Gut-Microbiota-Brain Axis, and which is also the topic of this presentation. But first of all, before we dive in deeper into that, how did you get interested in that topic? I know you've been researching it, done work and research there for a long time now. How did that get started?
As a young person who was growing up in subcontinental country, I was always exposed to, okay, don't eat this, don't eat that, because, obviously there's a high risk of getting bad bacteria. So that was there since childhood. But then when I took up pediatrics as a specialty and then trained in as a postgraduate in pediatrics, we got exposed to, the possibility of infections in probiotics and the possible role of good gut microbiota. And then there were a lot of newspaper articles about fecal microbiota transplant, which was changing lives, particularly from the US and certain parts of Europe. And when I immigrated to Australia in 2009, actually, that was something which I had at the back of my mind to pursue as my, possibly through a PhD or similar research. And I am very fortunate actually to have embarked on that field. I think the gut microbiota is extremely important, and it plays a very crucial role, not only in the first 1,000 days, but you can see that, whatever you eat, So it's truly like gut feelings, like whatever you eat, it does influence your emotional state and, the quality of life, as well as generally quality of your sleep and several other aspects. So, yeah.
Absolutely fascinating. And it is so fascinating. We learn more and more about this. This is relatively a new area still, although there is a lot of research done now, but it's still, I feel like we're still in the infancy, right? I mean, like you mentioned, fecal transplants and things like that. That's been just a few years ago, would have been unthinkable. Nobody would have thought about that. But
Yeah.
where do you see this going in the future? I mean, I feel like this is like we're just scraping, the surface right now, right?
Yes, it's absolutely, you are quite right in that. I think we just have explored the tip of the iceberg, and there's this huge, area which is still, several aspects of it which people are still trying to understand. But I think in terms of its translational potential, particularly for several different a range of diseases that we looked at in the presentation as well, like not only in the infancy and neonatal period, like we routinely do use probiotics for neonatal complications such as NEC and sepsis, but they are very, very important even in later stages of life, like certain neurobehavioral conditions. There is a lot of evidence published on improving anxiety, stress, depression in adults, as well as reducing, improving cognitive performance in dementia. So obviously we haven't explored it to the fullest possible extent. So yeah.
That's absolutely fascinating and amazing. Yeah, and you mentioned it before, and I know you will talk about that, of course, in your presentation. Probiotic use in neonatal units, is widely available, but it also varies quite, drastically across the globe, if I'm not wrong. I
Yeah.
still know that although there's been a lot of research done, a lot of clinicians still, they're recommending it's in use to premature infants, but others still are a little bit hesitant and want to see more evidence, and also on the probiotic products themselves. What do you see in Australia? In your area, it sounds like it's widely used. Are there still some areas where you feel like, well, some people, maybe some older practitioners are not yet quite there, or what do you see?
Oh, so we have 25 neonatal units, which are a part of the Australia and New Zealand neonatal network. And I'm very happy to actually say that most of these units do use routine probiotics, specifically for infants less than 32 weeks of gestation. So which is obviously the higher risk for, feed intolerance and infections, as well as developing necrotizing enterocolitis. And I'm actually really proud to say that our unit was the first one to introduce routine probiotics in
That's amazing.
2010 in Australia. And similarly, like we have helped other units across the neonatal network to try and, procure probiotics for routine use in their infants. So I think we are a very pro probiotic continent.
That's fantastic. That's amazing to hear. And now I have a question for you. Something that I've heard or read, and maybe this is something older that's no longer a concern, but I remember seeing something, about probiotics in preterm neonates, and it was saying in there, it has to be absolutely done right, correctly. There's no just like one fits all, and if it's not done right, then it's useless. So do you actually prescribe the probiotics depending on the situation, what's going on with the infant? How does this work?
So in our unit, we routinely give probiotics to all babies who are born less than 35 weeks. And we start them with their first feed, and we continue them till the time that they are ready to go home, or at least till 37 weeks gestational age. So we do have a very standardized way in which we dilute the probiotics, preferably in mother's own milk. And then a very standardized dose that we give. But we have very stringent quality control in terms of, we have our independent safety checks, like microbiological methods, to try and make sure that, there is no contamination in the probiotics. We follow strict hand hygiene protocols, and there are very strict protocols in the neonatal units as well. So we try and make sure that, we are doing the following all the right steps. Yeah.
Yes. Okay. Let's briefly call, because we already talked a little bit about it, about the presentation, Gut Microbiota Brain Axis in Neonates and Infants. Tell us just a little bit, what can we look forward to learning there? What do you hope our viewers will take away with them after the presentation?
Well, that's a very interesting question. My main objective behind giving this talk was to try and introduce this big topic in a simple manner, because I think with many studies being published over the last few years saying that, first 1,000 days of life, the early postnatal life, that is the most important area for interventions or modulations which can actually improve outcomes in later life. I think the understanding the role of the gut microbiota, and also trying to bring in certain nutritional interventions, or certain interventions which can improve your gut microbiota in this susceptible period of life, can actually play a big role in improving your longer term outcomes. So I think that was my main intention of trying to present certain evidence for, like what are the factors which are responsible for gut microbiota establishment, how can you influence these factors, and what you can do to try and, improve or optimize long-term outcomes in this high-risk populations. So, yeah.
That sounds fascinating. I can't wait for your presentation, Dr. Gayatri, Jape. Thank you so much for sitting down here with me, chatting. Thank you so much for your time. And we see you at the conference. It was absolutely wonderful meeting you today.
Likewise. Thank you, Christine. Have a lovely day.
And this is a little information here for our viewers. If you're interested in that presentation and you would like to learn more also about the other presentations in the conference, we invite you to go to goldneonatal.com to learn more. Thank you everyone for watching, and I hope to see you at the conference. Bye-bye, everyone.
Bye.